Okay, everybody. So thank you for joining us. My name is Blake. So I'm one of the pharmacists here at TaylorMade Compounding. I know I'm sure I've spoken with quite a few of you all. But again, thanks for joining on this webinar based for some of our new hair loss protocols, our hair loss products for peptides. As we know, hair loss, unfortunately, is a very common condition, an issue that we see with both men and women. Specifically the women, obviously it sometimes can cause them a little more higher stress levels, anxiety, depression, but obviously that can be an issue for men as well, but things like that is just only going to snowball the effect with some of these hair loss issues. Our common treatments, like many people know, that we are familiar with, finasteride and dutasteride, commonly for men, and then the minoxidil, or Rogaine, has been a big hitter as well. But we really haven't looked into some of the the endogenous peptides and things that are already inside our body to really find the foundation and what's really going on and what things that can benefit us that we already have in our body. So one of the first ones I'm going to talk about, or the first peptide I will talk about, is the GHK-Cu, or GHK-Copper. So the GHK-Copper is, it's a naturally occurring copper complex that was first identified in the human plasma, but it has since been found in multiple locations throughout the body, specifically the saliva and the urine. The GHK-Copper has a variety of roles in the human body, including promotion of wound healing, antioxidant, anti-inflammatory effects, stimulating collagen synthesis, promoting blood vessel growth, so it's very angiogenic, and also is able to activate the hair follicle stimulation, which is one of its biggest uses, and why it's so beneficial in our hair loss patients. And I'll get into each condition and why it's beneficial, but overall, GHK-Copper it's a potent protector of the tissues and an anti-inflammatory agent that really controls the oxidative damage that occurs post-tissue injury. It plays a big role in signaling tissue remodeling, which removes damaged and scarred tissue and allows it to generate new and healthy tissue. But unfortunately, a lot of these positive effects, decline as we age. A lot of this decline is due to, it's been shown that the concentration of GHK-Copper in our body decreases with age. So, as the GHK-Copper decreases with age, we're going to see an increase in inflammation. We're going to see an increase in different cancerous activity, and just overall tissue destruction. So that's why this peptide specifically, can be so beneficial in a variety of different ways, in a variety of different conditions, and why I think it can really benefit, many of your all's clinics and your all practices and your patients.
I'm on this conference.
So here are just some of the indications that we see being, hair growth restoration is probably the biggest one that we see. Wound healing is another big one, specifically, skin lesions, and different types of skin cuts, any kind of wounds like that. Facial cosmetic use is probably our second biggest use for it, especially in the integrative anti-aging space. So when you're dealing with, people wanting to stay younger, look younger, get rid of those wrinkles or prevent those wrinkles from coming, specifically around the face, and just helping tighten that skin and skin elasticity, opposed to using some of the other, treatments such as Botox. but some of our facial cosmetic uses with this and our creams, we've had really, really good anecdotal feedback. Anti-cancer and even cognitive health. So the anti-cancer and the cognitive health, I don't have specific slides on this PowerPoint, but I'll briefly talk about it at the end of these slides. So here is, some of the effects that it has on hair loss and why it is so beneficial and why we see such great benefits in a lot of our hair loss patients. So as I mentioned, the hair follicle stimulation for hair growth, it stimulates proliferation of the dermal fibroblasts. I also mentioned, being very angiogenic. That's due to its elevation in production of VEGF, which promotes that hair growth and follicle size by really getting that blood flow and that vascularity around the hair follicle. Hair follicles are just like any other tissue or organ, that we have. It's not going to grow or thrive if you're not getting adequate blood flow to that hair follicle to allow that, the hair to really grow and grow in thickness as well. Another issue with hair loss and treating hair loss and trying to get the hairs to grow as we would like is the inflammation. So inflammation on the scalp can be a big issue due to a lot of outside conditions, whether it's different weather temperatures or just simply irritation, whether shampoos, anything. Inflammation it can really be a damper on hair loss and really trying to treat that and get to the hair follicles. So GHK is a pretty potent anti-inflammatory, so it can really help decrease that inflammation on the scalp. So as I mentioned, minoxidil is obviously one of the most common hair protocol or hair products that have been used in treatment. And this one went head-to-head on a study with the 5% minoxidil, and it was shown to be superior to the 5% minoxidil in the restoration of hair growth. And another definite pro of the GHK copper when it comes to hair loss is the no rebound effect or reversal effect that you do see with the 5% minoxidil. So for those that have used or had experience with the 5% minoxidil, when patients typically go off of the minoxidil or decide they want to stop the minoxidil or Rogaine, you get some excessive shedding. So you get that rebound effect where it almost gets worse once they stop the minoxidil. And obviously, from patient standpoint, it's kind of like all the hard work and adherence is for nothing. So this is one that it doesn't have that effect, that rebound effect. So if you do, you get the benefits from this and you do decide to go off of it, or the patient decides to stop, you're not going to have that reversal effect and kind of go back to, or have any kind of that excessive shedding, which is a huge plus for minoxidil. And even in my, experience as far as talking to patients, that's one of the first things that they ask me when they're, coming off, when they're trying to switch from minoxidil to GHK is, they've experienced that shedding, they've experienced that rebound effects, and we haven't had that with this, which is a big plus. So as I mentioned, the skin elasticity and the cosmetic effect for this GHK copper is a big one. So we make a cream as well, along with the sprays and topical foams for the hair. But we make a cream that you can utilize on the skin and in the face. That's been shown really good benefits as far as a firming, kind of anti-aging, anti-wrinkle activity on the face for different patients. So it stimulates collagen and the glycosaminoglycan synthesis in the skin fibroblasts, activates the stem cells, those local stem cells It induces proliferation of the keratinocytes in the dermis, which is going to, that's where that increased thickness, the reduced wrinkles, and that firmness of the skin is really gonna come into play. There was a study that showed that GHK outperformed the vitamin C and retinoic acid in increasing collagen in photoaged skin. So again, this is one we're also a newer product that we are going to be doing that's people are going to be interested in trying is we're coming out with a GHK along with hyaluronic acid as a topical that people are going to be able to use across the face for after dermal rolling and microneedling to really get the GHK and that hyaluronic acid into the skin and really promoting that collagen synthesis and activating those stem cells, to provide a overall skin tightening of that skin and having the skin elasticity that you're looking for. And there's also, we've even had patients where, this is an injectable as well. So we've had some patient or doctors that have been experimenting and trying to use it for systemic use and systemic skin elasticity and tightening of the skin, specifically on those patients that, may have lost a lot of weight and do have some excess skin, or for whatever reason maybe they have that excess skin, and we've had some really good feedback as far as the injections go, as far as systemic overall skin elasticity, because most of the studies have been topical versions. So that's promising to see as well, to have some of that systemic effect on the GHK. So wound healing, the GHK is a potent wound healer, which can also be effective systemically as well, along with the local, using the different types of topical creams or gels that we have for the GHK. It's been shown to attract immune cells such as the macrophages and mast cells. It's promotion of the blood vessels, as I mentioned. It's angiogenic. Getting the blood to those tissues is something that's very important in order to start that healing process. And it's antioxidant, anti-inflammatory effects, and faster wound contraction and epithelialization. As I mentioned, it does work systemically. It's been shown that systemic injection of GHK copper can also cause an enhancement of the healing process. So, an injection, into the skin, sub-Q, can promote that tissue repair at distant locations. So it is going to work systemically. You don't have to do it at the site of injury. It showed that, injections of GHK cause systemic increases in collagen production, angiogenesis, and wound closure. So, that's where, I mentioned the systemic collagen production and skin tightening, and that's where you can really see those benefits. And there was also a clinical trial in diabetic patients that was pretty interesting. There was a trial for those diabetic patients suffering from ulcerations. When given a GHK topical gel, the wound closure of the ulcers increased by 40%, and the percent of infection actually decreased by 27%. That's showing extremely promising results for the treatment of skin injuries that can be difficult to treat due to infection. So those different types of ulcerations sometimes are hard to treat, and having to use systemic antibiotics or whatever it may be. So this is definitely could potentially be a very valuable therapy given to individuals even after surgery, to promote some of that wound healing and aid with the pain and prevent some of the infection risks as well. So a very interesting peptide when it comes to that as well. So here's the dosage. So as I mentioned at the beginning, I don't have a slide on the cognitive health or anti-cancer just because I know it really wasn't our focus on this webinar. But I did want to just kind of briefly mention, that it does have some pretty cool cognitive health benefits, potentially playing a role in nerve regeneration. There was a study that performed the effect on GHK and axons. It's shown that Schwann cells and axon count were increased. There was also, shown to increase production. There was increase in nerve growth factors in the brain as well. So, it's as far as some neurodegenerative diseases and things like that, I think this is a peptide that could, definitely play a role in that. And then as far as anti-cancer, it was GHK has been recommended as a treatment for some metastatic cancers. There was a study performed to determine gene expression of normal and cancerous cells and kind of figure out what substances could silence the genes involved in metastasis. They used a database of 7,000 genome expression profiles, and after a treatment of about 1,300 substances, it was found that only 2 were effective in turning down the genes overexpressed in those tumors spreading, and one of those 2 was GHK-copper. So that was a pretty cool study and showing that it could definitely have a future and some benefit down the road in some of our metastatic cancer treatments. So those were just 2 things I wanted to throw in there as well that weren't included, on the PowerPoint slides, but again, showing that kind of the pleiotropic effects of this peptide can really have some benefits across, a wide variety of patient populations. So the dosage here, shows 1 to 2 milligrams a day, and typically only 2 times a year. That's more so with the sub-Q injections. It's doing the 1 to 2 milligrams a day. Typically, they'll do that for anywhere 21 days up to 4 or 6 weeks, and then you do that usually like twice a year if needed. That's typically the dose. As far as the creams or the sprays that show in the method of administration, it comes as a sub-Q injection, topical spray, which you all will have access to, and then a topical foam. The topical foam, the downfall of it, sometimes patients, it does have it can mat the hair. So as far as an aesthetic standpoint, specifically women, obviously they don't like the matting of the hairs when they do apply it. We typically recommend, even with a spray, doing it at bedtime, just having to do it once a day at bedtime, and then you can leave it in throughout the night, and then you can wash it out the next morning if you would like. Especially with the foam, like I said, if it causes some matting, you may want to rinse that out the next morning. But typically, any kind of topicals, you're looking at once daily dosing. Like I said, usually we recommend doing the bedtime if you're dealing with the hair loss. As far as side effects goes, really you monitor for copper toxicity, but it really has not been an issue. So the GHK copper, it binds these copper. It has this copper, complex, and it really carries the copper around, preventing, turning it into its oxidative state until it's really actually needed. So it really gets the copper to where it needs to go, the injured tissues, or providing for angiogenic effects. So in that sense, it's a pretty cool peptide as far as that we really have not had any issues at all with any kind of copper toxicity. The thing to look out for, if you are concerned about that, is the luna of the nails turning blue. Not a huge concern, but if you do see that, it does correct itself over about 4 to 6 weeks. So that is about it as far as GHK goes. as I said, it has a variety of different, treatment options with it. It's widely used, hair growth, cosmetic agents, but it's clear there's many more indications for your clinics and your patients to utilize and benefit from. So I will go on to the next peptide, which will be much quicker, just because it doesn't have really the pleiotropic effects that that you see with the GHK copper. This one's really, we've only really using it topically for hair loss. So the second one is Zn-Thymulin. And Zn-Thymulin obviously is a combination of zinc and the nonapeptide thymulin commonly used for the hair loss. Zinc, as we know, is an essential element, and serum zinc deficiency can contribute to some hair loss. Thymulin's activity on the hair follicle was recently published in an in vitro study where several thymic peptides and showed thymulin could extend the anagen phase of the hair follicle. So the anagen phase, is that growing phase. So if you extend that growing phase, you're going to keep that hair follicle growing, and it's going to become a thicker, denser, stronger hair follicle. So that's obviously very important when it comes to the treatment of hair loss. Serum thymulin concentrations are very critically dependent on the presence of zinc. So that's where we get this combination of the Zn-Thymulin. So as I mentioned, here's kind of just a visual picture of the anagen phase. So as I said, the anagen is the active growth phase of hair follicles during which the root of the hair is rapidly dividing, really adding to that hair shaft. And that's where you really get like I said, the strength and density and thickness, that fuller looking hair that can really help improve, especially some of those thinning areas. So if you're keeping that hair follicle in that growth phase, you're really going to be able to keep those thinner areas looking much thicker and fuller over time. So the scalp hair stays in this active phase typically 3 to 5 years, and at the end of the anagen phase, an unknown signal causes that follicle to go into the catagen phase, which is that middle phase, detaching from that blood supply. And as I mentioned, once you detach from that blood supply and you have no blood flow getting to that hair follicle, like any other tissue, organ, any other living organism, you're not going to have, it's going to die off, unfortunately. And then after the catagen phase, it advances to the telogen phase, where the hair eventually, will fall and die out. So that was, again, that was essentially Zn-Thymulin. It's extending that anagen growth phase, keeping it in that phase. But when you use it in combination with another peptide such as, GHK, with hitting it, that hair loss issues from all different angles, you can really, really see some cool benefits. And these have been used from a variety of different doctors in combination even with those that are doing, PRP. They'll do PRP treatments, combining some of our peptides and then doing this on a daily basis at bedtime, just once daily. And we've seen some really, really good results. So this one, again, is typically 1 to 2 sprays topically. It's a topical spray or topical foam. One of the side effects, it's not a major side effect, but it does have some melanogenesis, where in some of the studies, some of the older subjects actually had some hair color change where they resembled more similarly to their hair color from when they were actually younger. So when the hair was, whatever color their hair was when they were younger, it seemed to grow and extend hair, change the hair color closer to what it was earlier on. So that was an interesting side effect. That was not in everyone, but it did tend to be more in the older subjects as well. So, but as far as that, it's not, neither one are, very irritating to the scalp. Haven't had any issues with, redness or any kind of irritation, itching, anything like that. So pretty well tolerated products from both sides. With that being said, I can open up, some questions, if you all would want to, unmute, if someone does have a question, I'd be happy to, answer any questions that you all may have. So maybe Barb, I have a hand raised. Let me unmute you. Do you have a question?
No, I'm good.
I have a question.
Okay.
Which form is best? The GHK-Copper. Which is the best form? Is sub-Q as good as the topical?
So when you're dealing with the hair loss, we always recommend the topical version of the GHK, just because you're really wanting to get, being able to rub it in right where where those follicles are. That allows it to really get absorbed into the skin locally there for the hair follicles. So as far as hair loss goes, we always recommend the topical. We've had good success with both the foam and the spray as well. So again, it's kind of just how the patient, if they're okay with the foam, tolerating with the matting of the hair, if that's not an issue to them. Some patients like that better, and then some doctors have preferred utilizing the spray.
And that's continuous every day, year round?
Correct. Yeah. Yeah, just once daily, typically at bedtime.
And you stay on it indefinitely?
Yeah, well, so again, you're not going to see the rebound effect. And both of these products, they do take a little bit of time. So we recommend at least 3 months when you're utilizing them before you start to see an effect. So it is something you have to be patient with, but you also have to be adherent to it as well. It's taking it, making sure you're doing it daily. So it's something that it's. Hair loss, unfortunately, is a never-ending battle. So, once you get to a point, you would be able to stop, and you're not going to get that excessive shedding or reversal. But again, eventually, your hair is going to start to have that hair loss again, and you're going to have to end up going back on. So I wouldn't say you'd have to do it indefinitely, but it's going to be, again, a never-ending battle where you're going to kind of have to keep going back to it, most likely. Let's see. Is there any other questions about either product? So yeah, so there is so for Michelle's question, topical can be difficult, for women to apply and get through to the scalp. Is the liquid a spray, or is there a more direct way to apply it? We are looking at, different types of applicators. Right now, it is a spray bottle. So, doctors haven't had issues with it. We just started the spray bottle probably, a month or so, 2 months ago. So some doctors have been switching to that and spraying just, pretty close to the scalp. But we are looking at different applicators to see if we can get it to where it's, maybe pinpoints to where you can get it right on the area where you're trying to target. Question from Dr. Rubin, for hair loss and skin, face and use spray will help both. Do you apply to scalp or both? So yeah, so for the spray, again, we do have a topical cream, but I know it may not be in for Body Logic's EMR. I don't believe the cream will be available just yet. I think you all are just having the spray. So the spray would be hard. I would be hesitant to spray it. I mean, I guess you could spray it directly on, I don't know if you would want to spray it maybe on your hands, or if you had a glove and had a spray it on the glove and then kind of massage it into the face. But I would be hesitant to just spray it. I wouldn't want to get it, in the eyes or anything like that. So as far as if you're trying to use it for hair loss and skin, specifically on the face, I would maybe try applying it, maybe on some gloves or some other kind of surface, and then kind of massage it into the skin before I would just spraying it. But the scalp, absolutely, you can just spray it right onto the scalp and massage it into the areas that you're looking for to improve the hair loss. Yeah. So would one of these formulas be better for a specific type of patient, or both? Honestly, I would use both because they both have different mechanisms of action. So you're definitely going to get some synergistic benefit from them. So again, with the Zn-Thymulin, you're really extending out that hair life and that growth phase. And whereas GHK-copper, you're really kind of building up that healthy follicle and providing it with essentially the nutrients that it needs to grow. So, you're providing it with that blood flow, you're providing it, decreasing any kind of inflammation around the scalp or around the hair follicles. So, it's one that I would recommend utilizing both products. And we are going to be making for Body Logic as well, a spray that has both products in one bottle. That way they'll already be combined. That way you won't have to worry about utilizing two different products or two different spray bottles. Oh, okay. Yeah. So would you apply one and then the other on top of the scalp? But yeah, so like I said, the bottle will already be pre-mixed for you. So it'll have both peptides all in one. So you'll only have to get one product. That'll make it easier for you all and make it easier for the patient. Only having to utilize one product at a time, or one bottle at a time. So that'll have both of them in there. That way you'll kind of get the most bang for your buck and still get that really great synergistic effect. When will it be available? So I know Ryan has been talking back and forth. I don't have an exact date on when it is going to be launching. I don't know if you all have been told an exact date. But I know we are pretty much ready to go on our end. Unfortunately, I don't have an exact date on when it's supposed to be launching, but I know very, very soon. My guess is definitely this month. So I know we have a couple of different products that I think we're launching for you all. I think Ryan maybe have already had one webinar with you all about some of the other products, but yeah, so we're very excited, and we've had some really, really good feedback on these for hair loss. So I think you'll definitely see some benefit no matter what kind of practice you all have and what kind of patients you all see. So they both are stable at room temperature. So that's kind of also a plus for most people. It seems like they like, obviously, being able to keep it at room temp and not having to remember to keep it in the refrigerator. But both of these peptides are stable at room temperature. So it looks like I've answered everyone's questions on the chat. I don't know if anybody else has any questions for me. And I can I can chat my email as well on here, which some of you I know may have it already. That way, if you all have any questions as well, let's see. So if anybody has any questions at all, I know that says from Ryan Smith, but that's my email, obviously. So yeah, so if anybody has any questions, obviously feel free to email myself or Ryan. And one of us will definitely be able to get the answer for you and get back to you pretty quickly. But I know we are all very excited to be able to provide some extra products for you all and get these launched and get some good anecdotal feedback from you all as well and your patients. So I think it'll definitely I think you'll definitely enjoy these and have some good success with these. Yeah, so if there's no other questions, I guess we can wrap up. And like I said, you all have my email now. And can we get the slides? Yeah, so we can either myself or Ryan will send out. We'll be able to send out this email. I think Ryan probably has the entire email list, but I'll make sure I get with him, and we can send out the PowerPoint slides to everyone. That will not be a problem at all. Yeah, so I can send you that out, and then if any of y'all are interested, in looking at some more of the studies or the literature, we have that, so you can shoot me or him an email, and we can definitely send that along to you as well for you to dive a little deeper if that's something that you'd be interested in. But yeah, so again, thank you all for listening in. Hopefully it was beneficial for everyone. Hopefully you all are excited about trying out the new products, and like I said, I think you'll be pleased, and hopefully your patients will be pleased, and can really make a difference for them. With that being said, again, shoot me an email if you have any questions, and looking forward to talking with you all and seeing how you all like them, and your patients as well. Thank you again, and you all have a good rest of the evening.